Good afternoon, everybody. Welcome to 77th APICON, that is the annual conference of Association of Physicians in India, held at Jaipur 22. First day, we have covered the first day, and in the first day, we have covered so many interesting issues, particularly on the cardiovascular and diabetic health, because this before independence, the infectious disease was the major killer disease, but there is a paradigm shift. And in the current century, non-communicable disease death is more than the communicable disease death. So prevention of hypertension and diabetes and its complication is the bread and butter of a physician. And cardiovascular disease, very simple thing. We physicians simply we regulating the salt intake, we can overcome the effect of hypertension, or at least we can prevent the stage 1 hypertension. And it is estimated that in globally, the WHO cutoff line should not be per day 5 grams per day salt intake. But often we take more than 10 or 12 milligram per day salt, particularly in the tropical countries. In our countries, it is very high, and elderly population who is suffering more from the hypertension is very salt sensitive. Minor increase of the salt intake can lead to huge increase of the blood pressure. And days are coming, people are taking more and more fast food, more and more junk food, while the salt content is very high. So this is essential to control the salt intake in the body. Not only the diseased person, also person who are susceptible to develop hypertension and diabetes, and this can save millions of lives. Another interesting issue that was discussed in the first day, that is the hypertension of the young age. We have an orientation. The hypertension is basically disease of the middle-aged or elderly population. But days are coming, we are getting more and more younger population and premature death. So that means a person who will die in his prematurely. So there is a huge burden on the society also, and country also losing an active man. So hypertension young needs a orientation. Though essentially it is basically essential hypertension 80 to 90% cases, but in the young there is significant portion of the secondary hypertension. So you have to search for it. The reason is secondary hypertension, if it is correctable, if you correct the cause or go to the root cause, there may be cure of the hypertension. That is the main issue in secondary hypertension, and why if we get a hypertension younger age, you should go in depth. Another interesting topic which was discussed, there is a hypertension in the younger age. Till now, we have the orientation that hypertension is a disease of the elderly population and older population. So, but the days are coming, the physicians are getting more and more younger population, and that is very significant because hypertension in the younger generation basically lead to more premature death. That is a setback for a family. So hypertension of the young population should be more carefully screened about the cause of hypertension and to be treated. Cause of hypertension means though 80 to 90% cases we think of the essential hypertension, but secondary hypertension also present in 5 to 20% cases. Among the secondary hypertension is the renal causes and use of the different drugs, obstructive sleep apnea syndrome, the thyroid disorder, then coarctation of the aorta, different endocrine disorder, Cushing syndrome, aldosteronism, pheochromocytoma are the leading cause. Essential investigation of this is important because if you can detect the cause of the secondary hypertension and if you can give the therapy, you can come out from the secondary hypertension, and patient will be relieved from the hypertension, and this is the benefit of treating the secondary hypertension in younger population. So as in the older population, you control with the diet, in the salt, and evaluate for the suspected secondary hypertension by the battery of the tests. And particularly the clinical clues is very important. If whether patient are flushing, sweating, you suspect the pheochromocytoma, you palpate the abdomen or auscultate the abdomen, give the renal blue, suspect of the renal artery stenosis, and do the required investigation so that you can help. Among the investigation, I always stress the potassium estimation that gives so many clues of having the secondary hypertension that is to be finally to be investigated and to be treated. third interesting topic in continuation of the previous topic, that the hypertension is young, there's an endocrine hypertension, because among the secondary hypertension, endocrine hypertension coming to the in number in second. First is the renovascular hypertension. Among the different hormone-related hypertension, these are the pheochromocytoma, Cushing syndrome, primary hyperaldosteronism. So they may be the cause of hypertension. Also, there may be coexistence of the essential hypertension with this. So, treatment and detection of the endocrine disorder is a must when you are dealing with the case of hypertension, whether it is essential hypertension or whether it is secondary hypertension, because hormone has a very important role in controlling the blood pressure. So even if patient has the essential hypertension, if you control the hormonal abnormality, you can, with a lesser amount of drug, you can control the blood pressure. So endocrine hypertension is a very important and is a specialized job to a physician who are dealing with the hypertension. So screening is essential, and most important is a clinical clue. You should suspect. You examine the abdomen for the renal view. You take the history of flushing and palpitation for pheochromocytoma. So, as a primary care physician, your duty to suspect any hormonal disorder, and you refer to the appropriate place for the battery of investigation that will diagnose the actual hormone-related abnormality and the hormonal cause of hypertension. That will be helpful again of controlling hypertension with a lesser dose of drugs.